Hey, how y'all doing?
All right.
Good.
All
Doing great.
right. Okay. Sorry, everyone. We ran into some technical difficulties, but that's okay. It gave y'all a chance to get you something cold to drink and something good to eat for the weekly COVID. Oh, you know what? I hope this doesn't what I'm about to show everyone doesn't give you all any ideas, but
Okay. Hey,
okay, all
hey,
right,
listen,
mind that.
listen, listen. You had to, it was red. It was red, so I'm okay.
You okay with that?
As
You're
long
okay
as
with the
it was
technical
red.
delay. Okay. But I just don't want our loyal viewers to get any idea. It's just a red cup that happens to have some beverage in it. Okay.
As, lo- as long as it was red,
There you go.
We good.
we're good.
Well, I tell you what, I certainly do appreciate having my other hosts on the show. It's great
Yes,
to see y'all again this week. We made it through another week, y'all.
Yes,
yes.
we did.
Made
Yes,
it
we
through
did.
another week. And Dr. McIver, of course, we couldn't do this without you with your COVID-19 weekly updates.
Okay. Well, I'm
Yeah.
glad to be here. Glad to be here.
Yeah, absolutely. So we don't have well, we do have special guests. So we have two very special guests, Marilyn and Winston, with us today. But we don't have any extra guests with us today because we're just going to purely focus on our COVID-19 situation and some of the things that are happening, not only locally, but we like to talk about it like Dr. Mack says on a global scale. So we're going to get into it. I'm going to share the screen in just a moment. Just want to remind our viewers that if you have any questions or comments for the doc or for either one of us, you can certainly post them in the comment feed or the thread for this particular live stream. And we, of course, are streaming for the network and a couple of other groups and to the Whittemore Community Magazine's page. We should be on the Gullah Geechee page as well. And okay, great. And then it'll be available also on YouTube a little bit later on. So, Dr. Mack, with that, I'm going to go ahead and pull up.
But
Oh,
what we can do first is let me give the stats first, and then we can kind of go to the individual slides.
okay. All right. That sounds
Yeah,
good to
yeah.
me. Mm-hmm.
So when April and I talked a little earlier, the thought was we would probably just focus more on what happened this past week in the world of COVID, trying to tie up some loose ends, and just kind of focus on that. The show probably won't be quite as long as it has been before, but just kind of to get information out that needs to be out. And really, I'm hoping that we'll get questions and we can spend some of this time answering some questions as well.
Mm-hmm.
A lot of times I'll get questions after the fact, after the show, and I try to get to as many of them as I can. But if we can get to some of them while we're here, that would be good as well. What happened? So, talking about the numbers like we normally start off with, um, in the world, on a world scale, the number of cases in the past 7 days has gone from 11.1 million up to 12.5 million cases. 11.1 to 12.5 million. As far as the number of deaths worldwide in the last week, we've gone from 526,000 to over 559,000 deaths. Specifically in the United States, in the last week, we've gone from 2.8 million cases to greater than 3.2 million cases. As far as the number of deaths in the United States, we've gone from right around 132,000 deaths in the last week up to over 136,000. Getting it closer to home in South Carolina, where we've seen some big increases in the last week. Deaths in the last week up to we've had almost 11,000 more cases in the last week, gone from a little over 41,000 to a little over 52,000. And the number of deaths in South Carolina in the last week have gone from 787 deaths to 922. And there's another 7 deaths that are probable, but still has to be confirmed to be COVID related. So we're talking about right at 930 deaths. South Carolina stats. In Horry County, we've gone from 3,900 cases to over 5,000 cases, 5,375 to be exact. Let me say that one more time. In South Carolina, the number of cases in Horry County, I'm sorry, in Horry County, the number of cases have gone from 3,963 to 5,300 cases in South Carolina. Okay. In Horry County, the number of cases have up to 5,375, and the number of deaths in Horry County have gone from 50 to 67. 50 to 67. In Georgetown, the number of cases have gone from 549 to 729 cases. And the number of deaths have almost doubled in a week, going from 4 to 7. Marion County, the number of cases have gone from 234 to 299 cases, and the number of deaths have gone from 8 to 9. So these are recorded numbers. Of course, we know these numbers are probably not the true numbers, but they are recorded as of today. So the numbers are going up, and we'll get into some more specifics on that. But April and I have got some slides. April's going to kind of navigate through the slides that we'll kind of go through. And first slide we'll talk about is just looking at the United States compared to other countries. On that first slide, slide number 1, we're looking at over the past 7 days. This slide is talking specifically about new confirmed cases per million residents. As you see, the United States is on a sharp increase, right around 750 per million residents, whereas countries like Europe, Canada, and Japan are certainly flattening and going down and/or going down. This is very significant because we're on an upward slope. And the problem is in this too, is that in 2 to 3 months, we'll be back in the cold and flu season where we really haven't gotten out of the first wave of these tests. The second slide is probably even more of a worrisome slide because it's looking at the world's worst outbreaks, and Arizona, Florida, and South Carolina are up leading a lot of countries in the United States as far as outbreaks over the last 7 days. That's staggering because, again, these numbers are continuing to go up, and you'll see a trend where a lot of these places where the numbers are going up, they either opened early or they really never shut down at all. But those numbers are significant. The next slide goes to look at more detail from the specific states that we talked about. And this is a percent change since reopening. Florida has a 1,399% change in the number of positive cases since they quote unquote reopened. South Carolina, almost 1,000% change. Arizona's high, Texas is high, and Georgia's high also. But certainly Florida, South Carolina, Arizona, and Texas are definitely hot spots and definitely areas of major concern. Now, even breaking this down a little bit further on the next slide, we look at it in states that reopened before May the 1st. The numbers are staggering because these are places where you're having an increase. And the point of these next slides that we're seeing is that as the states reopen earlier or never really closed, you're going to see that these states have sharp increases in the number of cases. So South Carolina, Alabama, Oklahoma, the next slide of states that opened up early. Tennessee, 279% increase. Georgia, 245% increase. Mississippi, 215% increase. And again, we're seeing that these are southern states that have been trying to fall in line with the president's apparent lack of major concern of this. The next slide talks about states that are seeing somewhat of an increase there with South Dakota and Colorado. Next slide. So the states that opened later, a lot of those are still having increases. Oregon, California, Louisiana, which was really a big hot spot before, but as you see, that curve is starting to flatten out a little bit instead of going up, let's say like California or some of the other states. Next slide. The South, the Southwest are states that are really getting hammered hard. You look at Virginia, and I want to really pay close attention to Virginia because the governor of Virginia is a physician. And I've been watching Virginia as well because my oldest daughter does go to college in Virginia. And since May 15th, they've had a 34% decrease in cases. So the states that have been more aggressive, the states that have been more proactive about trying to take care of their residents and citizens, we're seeing numbers that are decreasing, or even numbers that aren't going up as high. Michigan was a really bad hot spot at one time. Since June 1st, only a 16% increase, as opposed to, let's say, South Carolina, where it was almost 1,000% increase. Next slide. And just kind of rounding it out, states that have really been proactive. New York, of course, with Governor Cuomo doing what he's doing. It's been a 52% drop since May the 29th. Maryland has dropped off. Illinois has dropped off 54%. Chicago was a real bad hot spot. DC, almost a 60% drop off. Massachusetts, almost to 90%. And Connecticut, almost to 90%. And it's because those states were hit hard early and they put in the proper measures to help get these numbers reduced, which is showing that social distancing and mask wearing is very crucial in helping these numbers drop down. Next slide. Okay, so one of the things that came out was that worse than New York, how coronavirus exploded in South Carolina. And I think I just showed in slides earlier where there was a huge drop off in New York, I think 52% drop off, whereas South Carolina was almost 1,000% increase. And it's because they closed down. They did a lot of the proper things that were needed to be done, including surveillancing, including mask wearing, including shutting places down. I mean, I see pictures of Times Square that look like it was a ghost town. So it does show that physical and social distancing does work. Masks do work. And that this is something that we're not doing in South Carolina, haven't been doing in South Carolina, and that's why the numbers are going up. Next slide. Now, specifically talking about South Carolina, this is a graph that was taken from Harvard and researchers showing that 18 South Carolina counties should have stay-at-home orders. This is staggering. It was kind of similar to the slide that was shown last Friday when we had it up, comparing to hurricanes, which we can relate to a lot more here in South Carolina, where there was a Category 5. All these states that are listed in red here that should be stay-at-home orders were pretty much Category 5, would have been a Category 5 had this been a hurricane. So this is definitely an issue, and you know it's real, you know. And there's so much talk now about wearing masks or not wearing masks or infringing on people's rights, which is absolutely crazy when it's shown in places where they have been using physical distancing and masks where there have been drop-offs. Next slide. So in looking at this, and I took this slide from CNN, so to give them credit for that, looking at the number of deaths compared to other major events, there's been more deaths in the last 5 months of dealing with COVID-19 than the Vietnam War, 9/11, Afghan War, and the Iraqi War combined. So that's just to kind of put it in proper context as to how much of an issue that this is. And the latest models project by November the 1st that there'd be close to 210,000 deaths. So, you know, whether or not we get to that point, that's the trajectory that we're on as far as the number of cases that we're seeing right now. In the United States, There have been 600, almost 600 healthcare workers that have died from COVID-19. And that includes physicians, nurses, EMS, EMT, hospital workers, janitorial and custodial people in hospitals. This is staggering. I mean, it's absolutely staggering that people who are taking their time and taking it seriously to take care of the sickest folks are being put at this kind of risk. Next slide. So before I kind of get into a few other points, being that I am involved with sports medicine, this is becoming an issue here with the colleges. And the Ivy League voted on Monday, which most of us in sports medicine already knew that this was going to happen. They kind of pretty much made it known in those arenas, in those circles last week that this was going to happen. But they voted Monday to cancel football season for 2020 and possibly play in the springtime. You had the Big Ten that just announced yesterday that they're going to play conference games only. There's some talk in sports medicine circles that the ACC will probably do the same with just playing conference games. So again, there's a lot of whirlwind that's going around about should we play sports in the fall and that kind of thing. And I think that story is still to be written. But again, they very well may not be college football in the fall, or at least an abbreviation. My concern is that I don't think if there is a start, I don't think this. I think the issue is going to be whether or not you're going to be able to finish, and that's a major concern that conferences are looking at right now to try and figure out what they're going to do in the best interest of their school, their programs, and their community that the programs are in. Okay, gotcha. So in the big picture, that was a lot of information that I went through. In the big picture, what we're really looking at is the issue about schools. I know the chairman of the school board for Horry County is going to make a recommendation that schools not be started back until after Labor Day, probably somewhere around September 8th. I know Sumter County has pretty much said already that they're going to start their school year virtually. And so again, I think it's really these individual places looking at the areas and looking at how many cases they have in their area to try not to have, further outs in the area. This information is really mind-boggling, to be honest. I mean, I'm looking at these numbers and looking at the things that I'm saying, and I have to check it 2 or 3 times and make sure that that's right. I mean, it's really an issue, and it's mind-blowing to me that people are still even contemplating whether or not to wear masks or any form of covering over their nose and mouth. Mm-hmm. That's even an issue right now. All the hospitals in Houston, Texas are full. Houston has the largest medical complex in the world with their group of hospitals there, and they're full. In Atlanta, the Georgia World Congress Center has been turned into a overflow hospital.
Wow.
So that's already happening. The last 4 or 5 days, I mean, we've seen greater than 50,000 cases per day in the United States, whereas just several months ago, there was, about 15 to 20,000 cases per day. Now, granted, it is because the number of tests that are being done are more, but they're still less than what we really need to be done. Still far below what should be done on a daily basis. So I'll go ahead and let you ask any questions, and then we can kind of go from there.
Well, I've been watching a few live streams today and over the past couple of days, and there seems to be a resurrection of the conversation about the virus being airborne.
Right.
And so, I definitely wanted to touch bases on that today, because I don't know that people really understand what that means whenever they say the virus is airborne, or if it does have some new properties that makes it, I guess, more lethal at this point. If it has taken on and if it has gone airborne, so to say. So what is really going on in that area, Dr. Mack?
Well, the thought is that it always probably was to some degree airborne.
Yeah.
Again, I think we talked maybe about a month ago with the coughing, the sneezing, how far a cough droplet can go, a sneeze droplets can go, 3,000 droplets in a cough, 5,000 to 6,000 droplets or more in a sneeze. A sneeze can go 100 miles an hour. So we've always kind of known that. But the thing is now is that the more, if you're in an area where a person's singing or yelling, those particles can go even further. If you're in an area where the ventilation is not as good, and those air particles can circulate, more and be more of an issue there too. So a lot of different factors and variables go into that. But most physicians always felt that to some degree it was always airborne.
Yeah, and I guess that's what was kind of confusing for me, just listening to some of the conversations. It's almost like people are taking it as a new thing when,
I think
it's relative.
I think that's where that's coming from, April, is that now you're talking about putting kids back in classrooms.
Okay. Mm-hmm.
So I think that's why there's the resurgence of that conversation about whether it's airborne or not is coming back up.
Mm-hmm.
I think it's coming up because you've got teachers, and rightfully so, who are concerned about being in classrooms. You've got people that are concerned about their kids being on school buses.
Mm-hmm.
You've got all these kind of concerns now that you're putting people in classrooms that may not be well, where air doesn't circulate.
They were talking about the ventilation, yeah.
Right.
That they're not well ventilated. Mm-hmm.
Right. So that I think that's why a lot of that conversation is resurfacing. But as far as that being a new thing, it's not really a new thing.
Mm-hmm. There's a question from the comment stream. How reliable are the rapid COVID tests? On-site results or within 48 hours?
Well, I mean, they're pretty accurate. I mean, any test, there's going to be a certain percent of false positive and a certain percent of false negative. Okay, so let's talk about that for a second. I'd rather a test be a false positive and a person goes into quarantine than to worry about a false negative.
Mm-hmm.
The other issue is I had a person who I talked to, because right now my numbers of COVID patients, COVID positive patients that I have is right at 30 now. So wow. I've had a couple of people that tested negative, or tested positive first and tested negative 2 days later. Okay. And the question is, well, how can that happen? Well, it can happen because if the person who did the test and the test came back negative on that time, they might not have gotten a good enough sample.
Mm-hmm.
But you can feel pretty confident that if that test is positive, you have it or you have been exposed to it. There's still a question about the antibody testing.
Mm-hmm.
Antibody testing is still in question because some of those antibody tests will pick up any coronavirus. Remember, COVID-19 is just a type of coronavirus. The common cold is a type of coronavirus. Mm-hmm. So some of these tests are not as sensitive or specific to pick up specifically COVID-19.
Mm-hmm.
They're sensitive for coronavirus. They may not be specific for COVID-19. And remember, there's still a number of different tests that are out on the market right now. So so one test is not a one size fit all.
So Dr. Mack, go ahead, April.
No, go ahead, because I was going to a different.
Okay.
Yeah,
well,
layer.
This is changing a little bit, but I keep hearing in the news about a tipping point.
Right.
What is the tipping point? When are we going to know that we're at a tipping point? What will signify that we just have lost total control of this and the hospitals are overwhelmed? And
what's
the tipping point?
We're there now. The hospitals being oversaturated. There's some hospitals that are actually even calling in the National Guard to give their employees backup,
Yeah.
to give their hospital care back.
Mhm.
That's when you know you're at a tipping point.
Wait a minute. They calling in. Why are they calling in the National Guard
Because they can have medical help.
from the
I think
guard?
that's in
Right,
Texas. Yeah.
right,
Okay,
I had.
okay,
right.
okay.
Mhm.
So there's a local hospital that's called the National Guard too.
Mm-hmm.
Yeah.
Yeah.
Okay.
So Grand Strand is 100% capacity. Thailand's is pretty much there. Um,
Yeah.
Conway's opened up other wings. So I
Mm-hmm.
mean that's a good question about the tipping point, but we're there.
Okay.
We're there. Now some places the numbers are going down as the graph showed earlier. So it's not a linear thing. It's not like a one size fit all. There's some places that are getting hammered right now, like New York, New Jersey, Connecticut, Illinois, Louisiana, Michigan. They were getting hit hard early.
Mm-hmm.
Mhm.
They did the kind of things that they needed to do. But the problem is, and this is what we were concerned about, those areas up in the Northeast and the Midwest were getting hit hard. So people in the Southeast were like, well, it's not our problem. In the Southeast and the
Mhm.
Southwest. Now you got states like Arizona that's exploding. You got places like South Carolina, Georgia, Florida, Texas, Arizona that are absolutely exploding. Now,
Mm-hmm.
one thing I do want to mention is this, because this is kind of interesting and ironic. The very last state in the United States that had a positive test, the last state that had the first positive test was West Virginia. Okay. Now, West Virginia has the highest transmission rate in the country.
Wow.
So West Virginia has a transmission rate of 1.3. What transmission rates really mean is let's say if you have a transmission rate of 2, it means one person is likely to infect 2 people. If the transmission rate is less than 1, then it means that the numbers are going down. Right now, West Virginia has right at a 1.4% transmission rate, which is the highest in the country.
Mm.
So what it probably meant was West Virginia didn't take this as serious because they were the last people to have positive tests.
Right.
And guess what now? They're
They're
exploding
getting
with a high
slammed.
transmission rate.
Mm-hmm.
Yeah.
Mm-hmm.
I think it was also West Virginia where some people from West Virginia came to South Carolina and
Right.
took it back to West Virginia. And I think they've contact traced at least 100 people in West Virginia that they could trace back to Myrtle Beach.
West Virginia, Ohio, Kentucky, DC.
Mm-hmm.
Yes. Yes.
Mm-hmm.
Yes. Yes. Now, this is one thing that I want to say too, and I'm about to get on the soapbox for a minute, and I feel like I need to. Okay. So here's what I'm saying. If you test positive, this is not a secret. Okay? This is not a secret. If you test positive, you need to make sure that you can sit down and try to think about as many people as you came in contact with within the 2 weeks prior to getting tested.
Mm-hmm.
This is not a secret. Okay? It's not a secret. There are people that are testing positive that are not telling other people that they've been around that they're tested positive. That is absolutely horrible.
It is. It really is
It's
irresponsible.
selfish.
Mm-hmm.
It's selfish
Very.
and
Mm-hmm.
horrible. So if you test positive, because if you test positive, the odds are DHEC is going to call you to try to do contact tracing.
Mm-hmm.
Okay? But right now, there's a concern that contact tracing is not working as well in some places because you got too many people testing positive.
Mm.
But I'm saying this. If DHEC calls you and asks you, who have you been around? The odds are you're not going to remember everybody when they call you.
Mm-hmm.
So if you test positive and you don't tell somebody that you tested, people that you tested positive, you're absolutely wrong and you're horrible.
It had to be said. It really had to be said. We've got a number of questions that have come through, Dr. Mack, and I want to make sure that we get to everyone's questions or their thoughts. Thank you, Susan Sasser. We really do appreciate you watching every week to get the information on COVID-19. We certainly do appreciate that support. There's a question: can COVID be detected with a swab in the mouth, or does it have to be in the nose?
It depends on the test that you use. There are some tests that are designed such that you can get the swab in the mouth. Okay, so it just depends on the manufacturer and how that test is designed. I'm in the process of getting a machine that I actually can do it by a finger stick, and it's an antigen test which looks at viral particles. Okay, and so what that does is it'll be a lot easier, and the results can come back in about 15 minutes. So that's what I've been working on, trying to do as well for a number of different reasons.
Okay. There's also a question about antibodies.
Right.
Yours truly, meaning your mama, she saw where a person had COVID, but antibodies not produced.
Right.
Can one get COVID again, is her question.
Well, let me answer it this way. We're not sure that positive antibodies will give you immunity.
Say that louder.
So that's the reason, one of the reasons why physicians like myself are kind of leery about the antibodies right now until those antibody tests get better. Okay. So again, the antibody test in theory would be wonderful. If it had a high degree of sensitivity and specificity, it would be wonderful. But right now, there's still some question as to how reliable they are. And number two, if you have positive antibodies, does that mean you're protected? And we're not sure about that either. Because antibodies could be positive to the common cold, which is a coronavirus.
That's true.
Absolutely. Greg James asks, is it true that those that are asymptomatic can suffer long-term lung damage?
Usually the people, good question. Usually the people that are suffering long-term lung damage already have some underlying lung problem. Okay. So if a person is asymptomatic compared to a person who is symptomatic, the person that's symptomatic will probably have worsening lung problems. But that's a good question, but you have to know the person's overall history and if they already have an underlying lung condition. If they're a smoker, if they have asthma, if they have COPD or emphysema, if they have any kind of interstitial or tissue lung disease.
So Dr. Mack, you're talking about smoking has an underlying condition. I guess people would not know this unless they went to get tested. Say your lungs have been impacted by secondhand smoke.
Right.
And you pick up the COVID, you're not aware of that unless you said, I need to go get tested because I'm around smokers.
Right.
But that's an underlying condition.
Well, yeah, but usually if it's affecting the lungs, those people will know based off the symptomatology. So most of the people who are having long-term lung issues, they're symptomatic and they're having some issues.
Okay.
Sounds like you're a little
I guess I'm getting to, because people could have, it's not even secondhand smoking, but any conditions. You can have a condition and not be aware of it and get the COVID and die from it. And that's why it's important that people wear masks, because we don't know who has underlying conditions. You can't assume people are healthy, because there was a 21-year-old in Italy who died within a week of finding out about COVID because they found out he had leukemia.
That's the
and
point
had
I'm
no
making.
clue. Had no clue until he got sick from COVID.
Right. That's the point I'm making. But and that's an unfortunate situation. Now that's
but it happens.
That's gonna be the exception though, not the rule.
Okay.
So again, yes, that definitely can happen. But most of the people that are dying from COVID, they have some underlying problem that most of them already know about.
Okay.
But again, that's the reason why medicine is so complex. That's the reason why the body's so complex, because 1 and 1 doesn't always equal 2.
Getting back to the conversation about the West Virginians who went back, and then there was the uh, trace to
Breakout.
Myrtle Beach.
Mm-hmm.
Is it possible? This question is coming from the thread. Is it possible that those who return home had COVID before they came to Myrtle Beach? I mean,
well, let's talk about that because I've been asked that question a couple times too. All right, so that gets back to the basis of contact tracing. Okay, so let's just say if that was the only group that came to Myrtle Beach, left, and came and had COVID, then the likelihood may have been that they brought COVID here. But the fact that you've got multiple groups of people from multiple states, meaning that they probably got it here.
mm-hmm.
And that's the whole basis. That's part of the underlying basis of contact tracing. In other words, the question to me was, well, how do we know those people didn't bring it from West Virginia? And it's still possible that they could have, but it makes it more and more likely that they got it here when it's so many different places and the number is exploding here.
And it doesn't matter what region you're in. It still takes a matter of weeks for the coronavirus to show, or COVID-19 to show up in any test. Is that correct? So I don't know what that time.
Well, that's a good question. Okay. And some people are showing up as early as 3 to 7 days.
Okay, so it's kind of changed because before it was several weeks.
Right. Well, it will be up to a couple weeks.
Up to a couple of weeks, right.
Mm-hmm. So it could always happen sooner, but it could be up to a couple weeks in a lot of cases. Mm-hmm. Now, the other part of it too is that, this thing about viral shedding. In other words, you test positive. How long are you infectious? Mm-hmm. Okay, that's a commonly asked question. Mm-hmm. The thought is that most people within 2 weeks would be not really at the level of infections. However, that doesn't mean that those persons still may not be shedding some viral particles. Mm-hmm. So again, the older the person is, the more chronic medical conditions they got, the more likely they may shed virus for a longer period of time. But that gets back to the thing about, if, they detected COVID on a plastic 72 hours, it doesn't necessarily mean it's at a level to be infectious. They just found the viral particles on that surface. Mm-hmm. But the more sickly you are, the older you are, the more problems you have, that little bit of virin that might be on them may be enough stronger. Mm-hmm. Whereas a person that's otherwise healthy, that may not be enough to get them sick. Mm-hmm.
I think that's a little, for lack of a better term, scary to think that, if you've had COVID and you think that you're in a safe zone to be able to return to your normal activities and, return to work or family or whatever the case is, that, you still have to be extremely cautious. And I don't know that people really understand that. I don't know that they get it. They think once I've had COVID, like the flu, I won't get it, or I'm over it. I've already had it. So, all the more reason why people need to just stay
wear
safe.
Mask.
Yeah, wear a mask, period. Yeah, and just do, regardless of what you think. And of course now, and I must say this, ever since everything's happened with COVID-19, we have so many medical professionals who do not have degrees, and they're out here with their various opinions and thoughts on, they know more than Dr. Mack and people who've or veterans in the field about what's going on with COVID. And that kind of leads into our this part of a conversation about why people are just still so against following the guidelines and following the rules. But I think that goes back to something that I heard today in a totally different webinar. It just goes back to social behaviors. It goes back to human behavior, and just it seems like even human behavior has evolved into something that is unpalatable and very unreasonable. And I don't know what is driving that. you can attach it to a number of different things because now COVID-19 has become such a political debate. And I don't know when a mask became political and washing your hands and social distancing, but it has. And that's very worrisome because
it became political right around the time that the president said that you can put disinfectant in your veins.
Okay.
The problem is that the only thing that they're worried about is being reelected.
Mm-hmm.
And any sign of weakness, any sign, I mean, it's almost like he's looking at wearing a mask as a sign of weakness. Wearing a mask is a sign of strength. Wearing a mask is a sign of being considerate for your fellow man.
That's all. That's plain and simple.
And that's what it's about. It should not be political. But again, I've said this before. I'll say it again. Anytime healthcare issues become a political item, people die. And that's just the bottom line. Anytime it becomes political, people die.
People die. Yeah. Absolutely right. Well, we've got a number of questions and comments I want to get to. We thought this was going to be a short show, but the people say otherwise. So we got to get the people.
They hot.
Okay. Exactly.
Hey, Margie McIver keeps asking these questions. She better have something
that. I'm going to have to send her a link and add her to the stream. Yeah, because I'm sure she has some insights that she can share that would be very valuable to everybody. But anyway, okay, here's a question. Is there any legal way that daycare centers can get a positive listing? I mean, and the person says, parents will not tell us and try to drop their children off. So this goes back to what you were talking about as far as people, being positive and for whatever reason, feeling that they should not tell people, maybe, stigma behind it, or I don't know, embarrassment or whatever, but, they're putting people's lives in jeopardy. And I actually know of some situations in Myrtle Beach, excuse me, where their businesses, where employees have tested positive for COVID-19 and those businesses aren't letting their employees know.
Right.
And they're not informing the rest of the employees at the business.
That's wrong. That's absolutely totally wrong. This is a public health issue with life and death, some cases life and death implications. And even if the person that works in there, it doesn't get sick, they can become a carrier and take it to their parents, or they can take it to them. Okay.
Somebody threw out HIPAA.
Well, that's debatable about HIPAA.
Yeah.
Because if you're talking about a life or death issue, you have the right to do that. In other words, I'll give you an example. If I've got a patient that's HIV positive, and I know that they're not telling people that their partner that they're HIV positive, I can tell that. I can talk about that. That gets into an ethical thing. So when it becomes life or death, then HIPAA can be challenged.
With that also, I don't know if you can answer this, Dr. Mack, but if I'm a daycare center owner and I'm not made aware of students who may have exposed to the COVID virus and someone else gets sick, can I be held liable for that?
Good question.
That's a good
question.
I mean, I don't know the answer to that. That's a good question. I mean, but unfortunately, unfortunately, that's the risk that daycare centers have, and while they're still being open, and rightfully so, they need to be open because people got to work, and I get it. But that's the unfortunate risk that healthcare workers daycare workers will have, because again, not everybody's going to be honest. I mean, there appears to be a stigma associated with this, and like I said, if you don't tell people that you're positive, that you've been around, that is absolutely disgusting.
We did a show, Dr. Mack. Remember, we had Attorney Dixon from Atlanta.
Yeah.
And he, he talked about the legal implications of COVID-19, and he was relating it mainly to rec league ball and sports and a few other things. But then he also came from the standpoint of being a business owner because he has a law firm, and what he had to do in order to make sure that his law firm was safe for business and that his employees would be okay. But what I'm going to do is I will go back and post the link to that particular broadcast, because he actually touched upon this topic, and he talked about how, some of it is under workman's comp, and, what the legal issues are, what employees are liable for and what they aren't. But yeah.
Some of that stuff is state specific.
Yeah, he said that it was state specific.
So again, what happens in Georgia may not necessarily be the law in
South Carolina.
South Carolina. Mm-hmm. Right. Yeah. So it's best to have those conversations with your HR departments, because that's if you're, in a corporate setting or an institution where there's a formal HR division, and more than likely they are probably handling these COVID questions 24/7 in their sleep or whatever. But you want to ask those questions before you return to work, or when you return to work,
or reopen your business,
your business. Exactly. You want to do that. So let's see what else we have. Again, thank you so much, everyone, for joining us. And if you have any comments or questions, please post them, and we'll get through them. I promise you. So we talked about the daycare issue. Here's another question. Calandra Jones, Columbia, thank you so much for joining us today. Do you think it's safe for school to start back in 2020? Of course, that's the hot topic now.
Yeah, it is.
I think it's going to be tough to start school back in 2020. I think putting kids back in the schools in 2020 with the rate of rise that we're having in this area, I think is potentially playing with fire. I think that you're getting down to the issues, and that's a good question, Calandra. How you doing? Being a bus driver. I mean, how are you going to space these kids? How are you going to space these kids on a bus? How are you going to space them in the classroom? How are you going to tell them they can't be in common areas like the Commons area at Conway High School? Where these kids going to eat lunch? How are they going to be spaced apart? So it's so many questions instead of answers. And so I don't know how they're going to be able to do that safely.
Yeah.
And, it's worrisome. It's worrisome as a physician. It's worrisome as a father of three girls. I mean, it's worrisome. I mean, like I said last week, there's 534 zip codes in South Carolina. 534. Carolina Forest zip code had the fourth highest number of COVID cases per zip code in the state. Out of 534 zip codes. For God's sake, we got the Horry County Fair going on right now in Carolina Forest. For 10 days.
That don't make sense at all.
For 10 days. Socastee was number 7 as far as zip codes. Conway was number 9. Myrtle Beach was number 14. So 4 out of the top 14 zip codes for COVID positive cases are in Horry County. I don't understand how we're going to be able to go back to school with the numbers going up like they're going up. I mean, we're talking about going back to school in about a month.
Right.
Or better. How's that going to happen?
Yeah. I know that I guess they're going to be making their decisions come Monday. Ken Richardson was live last night and on Facebook and was talking about his suggestion of pushing Horry County School District back to after Labor Day as a start.
I think it should be further than that.
Yeah, I mean, if we keep pushing back and not dealing with the actual problem, which is people are not wearing masks, washing hands, social distancing, that's the issue that we're not addressing.
Right. And here's the thing, and I said this when we first started doing this, that we need to be dealing with data, not dates. We need to be dealing with scientific data on these numbers and stop trying to deal with dates. Because that's what's happening, and that's what's getting us into trouble, is trying to set up, oh, on this date we're gonna open up. Well, the numbers may be 2 times as high as at that time as it is right now. And I understand you got to have some kind of gauge for it, but I think we're dealing with dates instead of data. And I think that's the problem.
Yeah. They were talking also about medical personnel in the schools. I don't know if everyone had a chance to. Dr. Matt, that water looks so good. You need to be able to share it with everybody on the street. You need to clear my throat. Look, my cup is empty. Okay, cup is empty.
Your red
cup is empty. All right. Fill it up after the show. But so the governor was on earlier, and I caught maybe the middle of it or whatever. I didn't really realize that he was on, but they were talking about whether or not there was going to be enough nurses in the schools to deal with issues should the children become sick or the teachers become sick. And I thought that was pretty interesting. And so the person who was speaking on it, she basically tried to remain, I guess, optimistic about the fact that there would be enough medical personnel in the schools to handle certain situations. But as she was talking, my thought was, and it aligns with this question here that Amanda Butler has. Medical personnel is already, stretched out. And I know that, we have school nurses and things of that nature, but the medical personnel in schools, is that even realistic? Because typically they only have about one nurse per school, if they have a nurse at all.
And what happens if that nurse calls out sick?
That's right. If that nurse calls out sick, or unfortunately, she has a wave of students and teachers or whatever who are coming through, and has the school district attempted, this is Amanda's question, to consult with local physicians about what could be done in cases of the need for medical personnel, or even how to handle these medical issues in the schools?
No, what happens is the state's broken up into districts, and it's broken up into DHEC as far as so let me answer the question this way. They're getting the information from DHEC. They're getting the suggestions from DHEC. And that's how they're governing, and so they're not really talking to local physicians about that kind of stuff. I have had a couple of talks with DHEC, but again, they're getting their instructions from DHEC locally, who are getting their instructions from DHEC in Columbia. So that's where that information is coming from. That's where that suggestion is coming from. Now, again, I have been contacted by, on the athletic side of the school district, and what they kind of looked at from their policy is a lot of what we did already put together at Coastal. So that's kind of been, my main focus right now has been Coastal as far as schools go. Both on the athletic side and the non-athletic side.
Okay. All right. Here's another question that is all about sanitation when it comes down to food and the handling of food. Please revisit how to handle foods that come into the home. How do we best sanitize?
Well, I mean, that's a good question. I mean, right now it hasn't been shown that the food is a vector or a source of transmission of the virus, but certainly the containers that the food comes in, I mean, that's come into question. My take on it is to try to eat out as little as possible. I know that's not realistic for everyone, but at least if you're eating at home or cooking at home, you know who's been preparing the food. Again, it says data, not dates. I like it. Okay. So that's the thing about that, is that I would recommend, it hasn't been proved it can be passed through food, but food handlers, I mean, that's really on the restaurants to make sure that they're handling food in a proper way.
Mm-hmm. And as we know that Maryland, it's always going to be questionable because you got to rely on that level of honesty when it comes down
Right.
to employees coming in and not having the virus, and even in like I said, management knowing that their employees might be infected and yet
Right.
still, also,
I go ahead, April.
I was
I
going to
wanted to
say the
go
the
ahead.
PPE and glove situation with people still attempting to recycle these things. Do not wash the gloves and reuse them. Uh, the mask. I'm not even going to get into the mask situation right now, as far as how people are handling
And
that.
I don't want to be the bearer of bad news on this, but America is starting to run short on masks, gloves, and gowns again.
Hot nosy. Okay.
Yeah.
The supply chain is being compromised more because a lot of these gloves and stuff that we're getting are actually and PPE are actually coming from out of the country. So that is becoming more of a concern, especially as the numbers in the hospitals are exploding. Again, in Horry County, in the month of June, the hospitalization rate went up in Horry County 966% compared to the previous month. 966% increase. It's staggering. These numbers are absolutely staggering. And
That's regarding the PPE, and I was just seeing some video of folks in California, even the EMS going out and they had to pick somebody out who fell out in the yard. And they were in total hazmat, and they had the special helmet on with the shield that sucks out the air, so it can, have that tight seal. And they're like, it's like 111 degrees out in California.
Yeah.
And that's how, just so that they don't get infected. But that goes us back to us wearing our mask and being conscious of not only our neighbors and family, but these workers who are out here. Who have to deal with us, and it's become a vicious cycle.
It is, and the concern is that what's going to happen if these healthcare workers, if we continue to get sick. I mean, what's going to happen? I mean, who's going to take care of these folks? Who's going to take care of them? And so, like I said, in my practice, I'm pushing 30 folks that have been positive.
Another point that was made today in something I was watching, there were some experts at MUSC who did a live today, and they also had one of the state senators with them. But he's
actually my classmate in college.
Okay,
Senator Kempton, Marlon.
We came into Morehouse together. I've known Marlon since high school, so we're good friends.
Well, that's why he was giving such good information. Birds of a feather, huh? But he talked about.
Thank you, ma'am.
You're welcome. He talked about the fact that in my words, there's a domino effect to this thing, and to Dr. Mack's point. If our medical personnel are, and they're highly at risk every day because they're on the front line, and should they become sick, then we've got a big problem. So COVID affects not only you individually, it affects everyone around you and everyone you come in contact with. He also said something to the effect of, let's say we have our senior population and they're in the hospital being treated, and then they need to leave the hospital, and it may not be for COVID, but they need to leave the hospital and go to rehab for their rehabilitation state. They can't even really do that now because of the high risk of COVID in these rehabilitation facilities. And so it's like human beings, some human beings just don't get the point that this thing is like a fire that's raging out of control.
Right. If they're positive, they're not going to let them go to a rehab. So they're going to end up going home.
So then that becomes, more taxing on the family, who, of course, has to then take on the responsibility of providing some type of rehabilitative care. You do have your home health individuals who will come in and do what they do. But at the same time, you're inviting a lot into your home when you even have these individuals who are coming in, especially if they have multiple clients. So,
Right.
it's the kind of thing that horror movies are made of. And
It is. It is. Let me give you this other stat too. I just read this last night. In South Carolina, nearly 2,300 healthcare workers have tested positive. 2,300 have tested positive.
Wow.
So what that means is, as those healthcare workers have tested positive, they've got to be away from the hospital for at least 2 weeks. So what does that do? That puts more strain on the people that are still
On
there
the system.
working.
Yeah.
Right.
Mm-hmm.
So it's amazing, and I mean it's a domino effect when we can have these numbers going down like New York does, DC, Virginia, if we were just more proactive with what we were doing. Again, I've been following the state of Virginia. Again, for obvious reasons, my daughter's at Hampton, and so their numbers have been dropping. Their governor has been very adamant about doing the right thing. The universities, like I said, Hampton was one of the first universities to come out and say, look, there will be no in-person classes in the fall. So that's big. I mean, that's proactive, and it's putting health, wellness, and safety in front of dollars.
Absolutely.
Yeah.
A couple of more comments have come in. Marlene Woodyard, she says, should we be stocking up on toilet paper again? I never stopped stocking.
I never stopped either.
You need to do what you got to do, sis.
I grab toilet paper when I can.
One square per usage.
Excuse me.
That ain't gonna work, doctor.
Come on, man.
That ain't gonna work, Dr. Mac.
I'm joking. Listen, that's an inside joke. That's an inside joke here in the office. Because being your own business owner, I go out and I get the supplies for the office, and I always tease them, say, y'all using too much toilet paper. But anyway, that's a joke. That's a joke.
At least let them use 2. You said 1.
Better fold that 1.
Oh my gosh. We go skip over that. But yes, Marlene, please go ahead and stock up Lysol, masks, everything. And let's see. Yataqua Brown Grissett, thank you so much for tuning in with us today as well. She says she totally understands the importance of wearing a mask. In your opinion, is there one mask you should prefer over another? Cloth, cotton, spandex, poly, filter, bandana, etc. I know that it's been said covering up with something is better than nothing at all, but is there a preference?
Well, I mean, the higher grade it is, the better, because it is more likely to filter out particles that you would emit out. Remember, the mask is really to protect you from infecting other people or protecting other people. The higher grade the mask, the better. I mean, certainly if you got N95s, that's probably the best. But any covering that you fold over 2 or 3 times should help protect you. I'm not saying it'll stop it, but certainly it's better than nothing at all.
All right.
Very good. I do want to say something, April. Going back to the restaurants a little bit, the Gullah Geechee Chamber of Commerce, surprisingly, we support businesses, all businesses, small businesses in particular, but more importantly, we believe health before wealth. Because if you don't have your health, you can't enjoy your wealth. So we've actually said any restaurants where you go and you see that their staff does not have masks or practicing hand washing or hand sanitizing, is to not go into those restaurants anymore. Or any business, because we feel if they cannot take the time to invest in their employees, they're certainly not going to invest in you as a customer.
Right.
And that comes down to customer service. And it is a bit contradictory for a Chamber of Commerce to say that, but we are not here, especially in our community, to kill people because we want to make an extra dollar that day.
And the other issue too, further in that, is that they're cutting corners there. They're cutting corners other places too.
where you
True.
can't see.
Believe
Right.
That
that.
document where
Exactly.
you
Mhm.
can't see. So
Exactly.
Believe
if
that.
you out in public cutting corners, you know behind the scenes they doing
Exactly.
some mess.
Mm-hmm.
Hmm.
Mm-hmm. Absolutely. Well, I just have one other thing that I want to, and this is not to instill any more fear in anyone, because of course we already have enough of that right now. But we now have this issue, or at least it was trying to creep into the media as an issue of the bubonic plague in China. What do you know about that, Dr. Mack? And is
Well,
there any immediate
it,
threat to us, or?
I mean, I think the story on that is still to be written. I mean,
Okay.
those were wild rodents that they found that had bubonic plague. To think that that virus from the bubonic plague, it mutates. So to think that it just showed up, it's been here. I think that people are just being more vigilant in checking animals to see if they're carrying any other kind of viruses. Because here's the thing, and this is still something that hasn't been totally proven just yet. The leading thought is that COVID-19 came from bats. Okay, that's the leading thought. Now, there's other people that's got conspiracy theories about it was man-made and this and that, and that's a whole nother issue for another show. But for right now, the closest molecule, the closest genetic sequence that's been found has been found in bats. Okay, the problem is in science, we don't know if there was another vector in between before it got to humans. In other words, did the bat infect another animal who then that's where humans got it from?
Mm-hmm.
So transmission is still a question 100% about where it came from. The genetic sequence looks closest to bats that had been isolated years ago by this scientist in Wuhan who actually was called the Bat Lady. And you can look her up. I mean, the stuff is it's not under lock and key, but she
Right.
found a genetic sequence that has been a match to COVID-19. Um, but again, did it come directly from bats to humans or bats to another animal and then humans has not been 100% isolated yet.
Okay. Well, we'll save that issue for another day. Like you said, cross the bridge when we get to it, I guess.
Right,
We got
right.
enough to contend with as it is. But this has been a very productive and hearty conversation here. And I appreciate everyone for watching us today and posting your questions and your comments. We really enjoy the engagement. And of course, this
Hmm.
information is for you. It's not for us. No form or fashion. We're not trying to kick up likes or anything like that. We're just trying to educate and inform. And
Right.
Dr. McIver is definitely a trusted source and someone who I've, of course, decided is the person that I'm going to follow. Usually, if something comes up, I'm going to kick it to him and ask him, if he knows anything about it. He's going to send me a bill soon. I know he will. Uh, but anyway, we just want to thank you all today. And of course, continue to post your comments. We'll
Right.
continue to come back on Fridays. As the information rolls in, and as you're watching things, just be mindful of the source. That's one thing that you really want to make sure that you are vigilant about. Everything you hear on the internet is not true. You got to do your research as well, and if it's something that you question, write it down. And then on Fridays, when we're talking to Dr. Mack,
Hmm.
maybe he can answer it for you. You can always send it to me in advance, so maybe we can do a little research. But again, this is for education purposes, and we just want to inform the public, and we're all in this together, so why not? Yes, sir.
One thing I do want to say, because I want to end on a positive note.
Mm-hmm.
Um, so far in the world, there have been 7.3 million people that have recovered.
Yes.
So far in the United States, there's been 1.4 million people that have recovered. Again, when we do the right things, we do it the right way. And it's the same thing we've been saying. So that story hadn't changed as
Mm-hmm.
far as what to do to reduce the risk of spread, transmission, and acquiring this. That hasn't really changed. Protect yourselves, wash your hands, wear your mask, social distancing, watch the number of people that you're in close contact with. As long as you do those things, these numbers can go down. And that's true because we've seen it go down in places where it was taking off like wildfire.
Mm-hmm.
So doing the right thing can make a difference. We know that. But again, I do want to say, if you test positive, you need to let people know who you've been around. And you need to sit down and think about it. This is not a secret. This should not be a secret.
Positive should not be a secret. That should be a chant. We need to put that on posters and walk around with. Seriously.
But be careful, because these numbers usually will start to go up after big holidays. We've had Memorial Day. About 4 to 6 weeks later, we started seeing these numbers go up.
Yep.
We had the 4th of July. The likelihood 2 to 4 weeks from now, the numbers are going to go up.
Mm-hmm.
6 weeks from now, 5 weeks from now, whatever, we're going to have Labor Day.
Mm-hmm.
So again, the way that these holidays are spaced out, the fact that there is a lag time before people have symptoms, if they have any, but the lag time there will put people at risk, in those areas, particularly where we live in high tourist areas.
Mm-hmm. Mm-hmm. All right. So if there aren't any other questions or comments, again, we just want to thank everyone for tuning in today. Wendy Brashar Willis from New York, we appreciate you. Thank you so much. And Wendy Anderson, my classmate, Conway High School, thank you so much for tuning in. It's wonderful to see you here today. And again, we will be back next Friday at 4 o'clock. We're here every Friday at 4. COVID-19 updates with Dr. Mac. Rosita Dukes, Sugar Hill, thank you so much for tuning. Sugar Hill in the house, yes. Thank you so much. We really do appreciate it. Yes, continue to pray that we have the strength to do this and that Dr. Mac has the wisdom, because we couldn't do it without him. So thank you so much. And again, whenever you're tuning in on Fridays, please share the information, share the video while you're with us. And the more people we can educate and inform, the more lives we can save. So thank you all so much. We really do appreciate it. And we'll see you again next week.
Okay.
Good night. Thank you.
All right. Good night.
Good night. Thank you.